Hi everyone, I'm Sandra Arevalo once again here from Montefiore Nyack. I'm the Director of Community Health and Wellness, and today we're going to be talking about cervical health or also cervical cancer. And with us today, we have one of our newest doctors here in Highland and Montefiore Nyack is Dr. Rocio Gonzalez. And we're very proud to have her today. It was kind of last minute. So I really thank her for her presence here, and Dr. Emerson, who's, the lead for the OBGYNs, for her contact. So thank you so much, Dr. Gonzalez, for being here. And you were just telling me you're from Guatemala and you started working here how long ago?
Hi, everyone. My name is Dr. Gonzalez. I'm from Guatemala, that is right. And I started working with Nyack the first week of January. So I just recently moved to this big family, and I'm very happy that you're having me here. It's a pleasure, and I hope, we can have a conversation regarding cervical cancer.
Yeah, that's beautiful. So, Dr. Gonzalez, I know that you're a little pressed by time because you have to go back to patients. So let's get into the topic right now.
Okay.
Can you explain to us a little bit about the cervix? Like, I don't know if everyone out there is familiar when we hear cervix or cervical, if we know what that is.
Okay, so the cervix basically is the mouth of the womb, okay? That is located on the top of the vagina, okay? So the way that we can see where the cervix is through a vaginal exam. Every time that we have a pap smear or a gynecologic evaluation, we place a speculum so we can see the part of the uterus that is available, just to the physical exam.
Okay. And what is
sometimes you can feel it, just
no, please continue.
No, sometimes even you can feel the cervix if you are able to introduce, your fingers, you can feel, like a rubbery, a small structure in the top of the vagina. That is what is the cervix.
Mm-hmm. And why does this organ get cancer, or how does that happen?
So basically now we know that cervical cancer is related with HPV infection. HPV is a virus. Basically, it's a sexual transmitted disease. And this is one of the most common around the world. I would say, about 50% of the population has it right now, and we have in the future. So in order to have cervical cancer, we need like a skin contact. So we can have cancer on the cervix to the intercourse, basically. But also we can have, HPV infection, depending on the sexual practices. Sometimes you have vaginal or anal or oral sex. The virus can be, in different, parts of your body. So basically we need a skin to skin contact in order to get this infection.
Okay.
So once the virus enters. Hello?
Yeah, we can hear you again.
Can you hear me?
Yes.
Okay, so once the virus infect the cells, what happens basically, the virus start growing with the tissues, and that is gonna make the cells to look different, start making changes. Sometimes the changes can be minor; they don't, cause any so many damage. But sometimes that the virus can cause major damage. So we have different kinds of HPV viruses. It's more than 100. So some of them can cause low lesions, or they can cause high-grade lesions. It depends which one we are getting. So basically, that is why we get cervical cancer. About 90% of genital tract cancers are related to the HPV, and about 10% are from different other causes, and actually that is rare. rare, but for a reason, it's very important always to have an annual exam.
Okay. How often after you get the virus will you develop cancer? Or like,
So
or how
in
soon?
average, you can get, so I would say, it depends on the immune system of the person. If you have a healthy immune system, it can take a long time. Actually, it's not something that is going to happen right away. You can have the infection, and the infection can persist for years. So in average, it could take about 10 years since you got, the exposure. But some persons or some people may have, cancer sooner, depending, if they have diabetes or they have any, anything that can, make your immune system weak, like, some immune diseases, if you have other kind of cancers, or if you have HIV, anything that can bring down your immune system, can make this virus more virulent and can cause more damage faster.
Mm-hmm. How is the HPV detected?
So the HPV is detected through specific tests. So there are different tests when we are looking for cervical cancer. We have the cytology, or what is called pap smear. That is the most common word that we hear. The HPV is a different test that usually is added to the pap smear. So that is called co-testing. So that means pap smear and the HPV testing. This usually, looks for a specific virus. So there is like, I would say about 14 kinds, of HPV, like a pool of virus that this test looks for. And that's it that way, usually we know when a person is.
Okay, and it seems that we have lost Dr. Gonzalez, so we're gonna pause for a minute. And this is my time to ask you if you have any questions that you would like to ask Dr. Gonzalez, please write them in the chat or the Q&A, and I will be very happy to read them.
Okay, I'm back.
You're back? There you go.
Okay, I think I don't have Wi-Fi here, so, and this is the better room, so I hope we can continue this.
Perfect.
Hello?
Yes.
Okay. Okay, I can hear you.
Good. So you were explaining to us how you detect the human papillomavirus.
Yes, it's a specific test, basically, that is added to the pap smear. So, and this is very specific, when we have a positive test, we know the patient actually is positive, and it's just positive or negative, okay? So, and the patient always can ask for this. Usually we do the co-testing after 30 years, and we repeat this testing every 5 years if the test is negative, okay? Before 30, we don't usually do, we just do cytologies without, the HPV. It can be added, but it's.
And we lost her. So let's just wait a minute. Thank you for those who are joining us. Today we are running a little earlier, as a matter of fact, because Dr. Gonzalez, our speaker, has to go back to some patients. So that's why we started a little earlier today, but
Hello.
welcome.
Hello.
We're back.
Hello.
Go ahead.
Oh my gosh, I'm sorry for that.
No problem. So you were saying that people need to be tested every 5 years.
So it's every 5 years. When we are, we start testing for cervical cancer when we turn 21, regardless when you start having, your sexual life. It's 21, and after that it's every 3 years until you turn 30. So we usually do just pap smears. And when you turn 30, so we start adding the HPV testing.
Mm-hmm.
If the HPV testing and the cytology is normal, we usually repeat this testing every 5 years. We don't need to do the pap smear and testing every year. So we are sticking to the national guidelines, and that's the current recommendations.
Are there any factors that put you at a higher risk to get the virus or cervical cancer?
Yes, of course, that is a good question. Actually, the most important risk factor is the age when you start your sexual life. The younger you get, in engaging, in intercourse, is you put you at higher risk for this. Also, the numbers of sexual partners in your lifetime. So everything is gonna depend, on your risk factors, personal risk factors. Okay. Also, smoking is also associated with this. Also poverty, when you don't have, access to medical care, and people also, that neglect, their health also are at risk because they don't get tested on time. So that puts any patient in actually a really, really high risk.
Mhm. Does the number of pregnancies or births have anything to do with this?
So that is a good question. Actually, I don't believe, it's related one thing with the other one. What I have, my experience basically is that sometimes when, you give birth and you have some cervical, lesions, the trauma of birth, sometimes can, kind of clean, some small lesion that can be in the cervix, but it's not going to increase or your risk for cervical cancer. It's not related. Basically, this is related to just, to sexual practices.
Okay. When you talk about sexual practices, and I think this might be a good question for a lot of people, does it matter if it's heterosexual relationships or, female to male, female to female? How does that anything, does that differ in any ways on your risk of getting HPV?
So that is actually a good question. So, anyone can be a transmitter, what you need basically is a skin contact.
Mhm.
So if, depending on that sexual practice, you may have HPV in your mouth. For example, if you do, oral sex, you are able to transmit this to someone else. So even, the HPV virus is associated actually with throat cancer, mouth, tongue, and neck cancer. So that is something, that can be transmitted in that way as well. So, but the most common, I would say, always is heterosexual.
So HPV can live in any part of your body pretty much?
So basically, yes, I would say yes, because there are different HPV viruses. There are some viruses that can cause, the vulgar warts in the skin. Basically, it's not the same kind of virus that can cause, cervical cancer, but basically you can have HPV anywhere, in the skin, anything, that depending on the cells, this is like, like a superficial layer of the skin that is basically affected by this kind of viruses.
Mm-hmm. And how do you treat the virus and the cancer?
So there are different treatments for this, and it's gonna depend, and on your age, what age the patient is diagnosed with HPV. It's gonna depend, and if the virus has caused, minor changes or major changes on actually if you have cancer. For example, if you have, a pap smear that says, it's normal, but it's just HPV positive, we don't usually treat these patients. What we do basically is we monitor. We know that about 80% of the patients are going to clear the infection in 2 years. What happens, the immune system is gonna fight this infection. If you have a healthy immune system, actually, you should be able, to.
We'll wait for her to get back. We can hear you, Dr. Gonzalez.
Okay, so as I was explaining, if the patient just have HPV and infection, but the pap smear is completely normal, we don't usually do so much. We just wait. The immune system has the ability to fight this infection, and almost 80% of the patients are going to clear the infection in about 2 years. Can you hear me?
Yes, we did. So if you clear the infection, obviously you lower your risk of cancer, correct?
I'm sorry, could you repeat?
That if you're clear from the virus and you're able to treat the virus, then you shouldn't have any more risk for cancer, correct?
Yes. Okay, so if you have a pap smear that shows minor changes, okay, as an ASCUS, what it means ASCUS is like cells looks atypical, but nothing else. It's like a gray zone. The pathologist is not able to say this is a normal pap smear or this is an abnormal pap smear, but a cell looks weird under the microscope. But the HPV is positive. Depending on the age of the patient, we are going to decide what to do. But most of the patients also, this is a very minor changes. We don't do so much. We also, follow up closely these patients, repeating pap smear every year until, the infections clears up. So if we have patients and actually they have, some of the changes, they are progressing. We have low-grade lesions, and if the patient is beyond 25, we need to do a colposcopy. This is a specific test that's gonna tell us if the patient has cancer or not. So we use like a specific microscope and some liquids like acetic acid or lure that is gonna light up any lesion that may be present on the cervix. So we can do some biopsy, we can do a better diagnosis. So we know exactly what is the problem and what is going to be the next step on treatment. So if we have lesions that, are higher risk, and those are the ones that have the potential to become cancer in 3 or 7 years if we don't treat them. Basically, so what we do is like a incision, we do something that is called a cone with like a small piece of the cervix, either with a knife. That is something that is done in the OR, or we can do it in the office with like a wire loop, and we are able to remove the part that is affected by the infection. Also, there is another modality that is called basically ablation. So some places are still using something that is called cryotherapy. Basically, they freeze the cervix, and that's layers of cells are affected by.
Now we know that she doesn't take long to connect again.
Hello?
Cryotherapy.
Hello, can you hear me?
Yes, you were talking about cryotherapy.
Cryotherapy, exactly. So that is something that is also an option, and it's something that we don't use in the practice where I am at right now, but it's an option that is very useful in other countries, like in Africa or Latin America, and that they don't have so much resources. They just do like a cryotherapy, and because patients don't follow up, so they basically see the lesion and they can just treat on the same spot. So, but that is something that is not done here. Also, we can do laser, that's another modality of treatment. So we are able to, burn on that area that is affected, that is another option. If the cancer is more advanced, some patients may need a hysterectomy, okay? So they need to remove the uterus, and depending on the depth of the invasion, and if the virus has caused more damage, in other organs, such the bladder, such the colon, patient may need, a very, very extensive surgery and may need chemo and radiation in the more advances, cancers.
Mhm. So I guess the treatment, as you explained, depends on the stage of the cancer as well. But let me ask you something. You in the beginning, you said that it takes about like 10 years to progress. So is this a very mortal cancer, or is this one of those cancers that if you find early is very treatable and curable and you don't have to worry about?
This is one of the cancer that actually, for that reason, we do a lot of screening, because it takes a long time, this is treatable and it's also preventable now with a vaccine. So that is something, that I believe, in the last 15 years, everything has changed, Cervical cancer was one of the most common, cancer in females. And now this has, it went down, in the number, I believe this is the number 4, and before it was number 1, long time ago. With the vaccine, this has decreased dramatically. So we don't see so many cases with invasive cancer nowadays. That is a good thing.
And Dr. Gonzalez, how do we get vaccinated against HPV? What do we have to do? Like, for example, I don't think I've been vaccinated. I don't remember ever being vaccinated. So for people like me, how did you get that vaccine?
Okay, so the current guidelines basically recommend a vaccine for boys and girls, ideally 11 and 12, when they are between 11 and 12, basically when they are in middle school. But they can be given earlier, at 9 even, until 26. So basically, we know the vaccines has about 99% of success to prevent HPV infections in the future if the vaccine is given before the very first sexual encounter. So that is the wonder of this, vaccine. So it's actually, really good. And basically, pediatricians and primary care physicians are the ones, that are educating and counseling parents, to give this vaccine to their children. But also you can have it if you never had it before. You can have it, at any time. So basically, in my office, I'm seeing a lot of patients that never been vaccinated, and every time they come with me for an annual exam, I always ask, "Were you vaccinated? Do you need any catch-up dose?" And if they don't know, I try to see, just look for your records and see you got in a school. Otherwise, we had to start giving the vaccine. Actually, there are 3 shots, that are given with intervals of 2. Basically, you need to have 3 shots since the first dose. Up to 6 months after that, it's going to be 3 doses. So, and about 3 or 4 years ago, the vaccine was approved for 45. So even though, you didn't have it when you were 26, you still can have it before 45. So that is something that, you can discuss with your GYN doctor. So if you want it, the option is always there.
Mm-hmm. So I guess I missed the mark, but it's good to know, and for a lot of people to know that, especially younger people, please, and parents, right? I wish I had known this. I have a daughter, so I wish I had known this so that my daughter could take the vaccine. I don't think I knew about this. So thank you so much, Dr. Gonzalez, for this great information. Also, for all people who are watching this video or seeing us live, If you want more information and you don't have insurance, for example, and you still want to have any screenings for the virus or cervical cancer, you can reach out to us, to our cancer program and cancer services program at 845-348-2000. And also we partner with a program from the state, to be able to do screenings for free. So please, take care of yourselves, take care of your family. You see how easy some of these cancers are preventable. Oh my God, I wish I knew. And it's right what you said. Like years ago, I remember, like, every woman in my family was having hysterectomies and all of that. And now look at this. It's like you rarely hear about it. It's amazing. It's amazing. This is one of the good things of medicine.
It is.
So thank you so much, Dr. Gonzalez.
Exactly.
Thank you for being with us, giving us this very
It's a pleasure. Thank you for having me today.
information. Of course, and I will be sending you the link. And thank you again for informing us and for being with us today. Thank you so much to our attendees, and I will see you next week. Next week, we're going to be talking about resiliency and the biology of stress and how stress affects. We always hear that, oh yeah, it is stress and that's why you're not feeling well, but actually we're going to learn next week how is that stress affects us and can actually give us some chronic diseases as diabetes and obesity and others. So I will see you next week. Thank you so much again to all of you, and bye-bye.
Have a good day. Bye-bye.
Bye.